Today, we're going to tackle concerns such as a loss of jawline definition, vertical neck bands, downturned corners of the mouth, as well as the turkey neck appearance beneath the chin and loose, crepey skin on the neck. The main player behind all of these concerns is the platysma, the most overlooked muscle in the neck. Today, we'll locate your platysma, feel and assess its condition, and then go through a 3-step protocol to restore its function and, of course, help correct all of these issues. For those who aren't familiar with the platysma, it's a thin, yet the broadest muscle of the neck. Like a delicate chiffon scarf, it drapes across the front and sides of the neck. The platysma spans a remarkably large area, making it one of the most influential structures in neck and lower face aging. It originates deep in the region of the second rib, then gradually extends upward, covering the collarbones and attaching to the lower face. So how do you find your platysma? And is it even possible? Absolutely. It's very simple. Gently pinch the skin along the side of your neck into a fold, and as you lift the skin, you'll immediately pick up the platysma along with it. Yes, friends, the platysma and the skin are inseparable partners. Dense connective tissue attachments lie between the skin and the platysma, which is why they don't glide freely over one another and often seem almost fused together. So, what's important to understand? The platysma varies from person to person and is largely determined by genetics. If you have a medium build with good muscle mass, your platysma is likely to be well developed. If you're naturally slender with a delicate frame, the platysma may be very thin and barely visible. Another anatomical variation is that the front edges of the platysma can interlace beneath the chin. In some people, these muscle fibers remain intertwined all the way down to the thyroid cartilage. In other words, the platysma forms a continuous muscular sheet in this area, and that's actually a good thing. In about 15% of people, however, the platysma fibers are separated rather than connected, creating gaps or depressions between the muscle bands. And here's a surprising fact from plastic surgeons. In about a quarter of women, a significant portion of the platysma muscle bundles are absent from birth. In those cases, the skin in this area is essentially supported by connective tissue alone, relying on its own structural integrity. As you can see, platysma anatomy varies considerably from person to person. So, what does yours look like? Let's perform a test and evaluate it. For this, stand or sit in front of a mirror. In a normal resting state, the platysma is not visible and does not form any contour under the skin. Now we'll perform a platysma activation test. For this, slowly pull your lower lip downward. If you're unable to do it, gently move your jaw downward like this. At this moment, pay attention to the neck. Vertical bands or cord-like structures should become visible. These are the borders and fibers of the platysma. You can, by the way, take a photo of it, if you're not squeamish, and then examine it afterward. Now pay attention to the following signs. Well-defined, symmetrical bands indicate a well-developed platysma. Weak or absent bands may indicate a thin or underdeveloped muscle. Now let's look at the anterior bands under the chin. Are they smooth and symmetrical? And now assess the bands on the lateral surface. These are the posterior borders of the platysma. One more thing to look at is the interlacing under the chin. In other words, if you see a continuous band there, or a sort of connecting bridge, it suggests that the platysma fibers are interwoven in this area. If the bands are separated and you notice a visible dip or hollow between them, then there is no interlacing. By the way, this is a high-risk area for the development of turkey neck. Let's go over what specific issues the platysma creates with age, and then we'll move straight into the practical part. So first, there are vertical bands, cords, or string-like structures, the well-known platysma fibers that remain in a contracted, stuck state. Second, there is a loss of definition along the submandibular line. The borders of the platysma begin to shift forward and become more prominent, and the cervicomental angle loses its definition and overall depth or aesthetic contour. Third is drooping of the corners of the mouth. That's straightforward. With age, the platysma can pull the entire lower face downward and hold it in that position, which naturally gives the face a tired, sad expression. Next is loss of a well-defined facial oval. The cause is similar. It's biomechanical. Due to downward tension from the platysma, the tissues of the lower face quite literally descend, jowls begin to form, and the facial contour becomes blurred, so to speak. What else does the platysma affect? As I mentioned, it contributes to the development of turkey neck. It develops when the edges of the muscle separate, creating a void, and the skin in this area loses structural support. Not very aesthetically pleasing. What else? Dry and lax skin. The issue is that the low density of sebaceous glands in the platysma region makes this area, along the anterior and lateral surfaces, particularly prone to dryness and wrinkle formation. And here's another issue I absolutely have to mention: an overstretched platysma. With prolonged forward head posture, its fibers begin to separate and remain fixed in an abnormally elongated position. If this applies to you, then no classic techniques like this will help. For lengthening the platysma will not be suitable for you. And now the question is, what do you do with all of this? And where do you go from here? There's no need to rush anywhere. Just follow me and go through a simple 3-step action plan. It's absolutely straightforward and easy to understand. First, we start by improving the quality and structure of the platysma through massage. Massage helps make a tight muscle more elastic and soft, releases spasms, and improves blood circulation. That part is clear. Second, after the initial stage, we improve platysma function with restorative exercises when the muscle becomes more pliable and relaxed, and only then can we move on to targeted training. And third, in parallel with the first and second steps, you identify and eliminate habits that overload your platysma. In short, we proceed like in fairy tales. First, feed it, hydrate it, and let it rest. In other words, support nutrition and blood flow and restore the muscle's quality. Only then do you ask it to work through exercise. Is that clear, or do I need to explain it even more simply? It's very important to me that you feel absolutely 100% confident about this. If everything is clear and you're with me, then give this a like. That way, I'll know it was all worth it and that we're moving in the right direction together. And now, let's move on to the practical part. Step 1. Just a reminder, we're working on improving the elasticity and softness of the platysma muscle fibers. What do? We work on softening fibrotic bands, adhesions, and fibrotic overgrowths, and improving the contours of the platysma. For this purpose, Revitonica includes a technique called the Cheshire Cat, which helps eliminate any trace of bands and cords. You already know how to expose the lower row of teeth, just like the Cheshire Cat. If you're unable to do that, just a reminder that you can slightly lower the jaw. Take one band in a deep grip and hold it firmly as if you were compressing a tight spring. Now relax your lips and perform kneading movements aimed at softening, or, as is common in manual therapy, breaking down and warming up fibrotic tissue, adhesions, and any fibrotic deposits within this band. This can take anywhere from 30 seconds to a minute. We're all different. Find your own timing. Our goal is to increase blood flow in this area and stimulate metabolism. And when you feel that warming sensation, that the band has become easier to work with and softer, then move on to treating the next band. Expose your teeth, firmly grasp another band, and work on it with a deep kneading motion. The pressure should be of very high quality and precise. Don't work superficially. Apply firm, effective pressure. Depending on the condition of the platysma fibers, your bands may be thick or thin, short or extending the full length of the platysma. Work through each band along its full length. Start higher up, then move lower and engage the section closer to the clavicle. You'll feel how, centimeter by centimeter, the band warms up and seems to melt under your fingers. By the way, if a band resists or slips out of your grip, simply re-engage it with these movements, bring it back into position, and continue working. For one session, it's enough to work on 3 to 4 tendinous muscular bands. And notice that during the work, you can imagine that you're holding a very dense piece of felt or a cord, and that you are gradually rocking, warming, rubbing, and smoothing the texture millimeter by millimeter. So you gradually increase the pressure and intensity, and over time, you'll notice that the platysma fibers become more uniform and even and no longer protrude so much under the neck. And at the end, in Revitonica, we always finish by gently smoothing the tissues and calming them down. And into all of these movements, add a sense of love and self-care. I'm confident, everyone, that you did very well. And if not, or if you have questions, for example, if the technique isn't clear, make sure to ask in the comments and we'll answer everything. And let me say right away, to bring our platysma back to life, it's enough to master 3 to 4 techniques. One is not enough. You need different approaches. So everyone, the first step of our algorithm is complete. Now step 2, restorative exercise. And here I'll apologize again, everyone, for being a bit long-winded. I know I have that rather unpleasant trait. Just a reminder, exercise is only effective when the muscle already has sufficient elasticity and is capable of proper stretching and contraction. If the platysma is like a stone, then trying to actively train it is, frankly, pointless, first of all. And secondly, it can lead to increased tension, even microtrauma, or, for example, worsening of the existing issues. Once again, first massage, then exercise. I hope that's clear. The good thing is that for the platysma, any effective techniques for the lateral and anterior surfaces of the neck, as well as the clavicle area, will be suitable. Remember that the platysma extends over the clavicles. You can also apply techniques to the scapular area and posture. In general, there are truly a large number of these techniques, and each of us can choose the ones that suit us best. And we'll be working with a simple, foundational set of techniques. Starting position, arms along the body. And what do? We slowly, without jerking, lift the shoulder upward to its end range. In other words, at first there was freedom of movement, and then it disappears. What do? We simply tilt the head toward the shoulder, and with the other hand, we gently push the shoulder even higher, compressing the lateral surface of the neck as if in a vice. Hold for 5 to 7 seconds. Notice that the chin does not lift up. On the contrary, it should be drawn downward, and the platysma is compressed as if in a vice. Excellent. Now slowly lower the shoulder with no jerky movements. Tilt the head to the opposite side, and with the hand gently guide the shoulder even lower. Hold for 5 to 7 seconds. The stretch should be very gentle. Repeat the technique once more. There will be 3 repetitions in total. We've already completed 1. Lift the shoulder, tilt the head, and with the other hand, pull the shoulder even higher. Make sure the head is facing downward. Create firm contact between the head and shoulder. They should press firmly into each other. Hold for 5 to 7 seconds, and now release the compression. Actively lengthen and stretch the lateral side of the neck. Do not lift the head. Use your hand to help lower the shoulder further. This active hand helps you more clearly feel the shoulder movement and increases the range of motion. We can gently guide the shoulder higher and lower, like this. And thanks to the active hand, both the compression phase and, by the way, the relaxation phase are carried out fully. 3 to 5 seconds have passed. We begin the stretch. Very good. In this way, we've completed 3 repetitions on the right side, and now let's do the left side. Again, lift the shoulder upward, tilt the head, gently lower the chin, push the shoulder even higher, and hold. Hold for 5 to 7 seconds. Feel how the shoulder and head gently press into each other. Lower the shoulder, tilt the head to the opposite side, and with your hand, help guide the shoulder even lower. Hold for another 5 to 7 seconds. Repeat. What is the essence of this technique? In order to bring the muscles of the lateral neck, including the platysma, into maximal contraction, we use the active hand to assist both in shortening and in stretching. Throughout the process, the active hand works very gently. In other words, you are not pushing or forcing your shoulder out of position. You are simply coordinating the movement with your active hand. Maximum contraction, maximum relaxation, just like this. Well, everyone, I hope everything is clear here. Once again, if you have any questions, I'll be happy to answer them in the comments. This integrated technique affects not only the platysma, but also all the muscles of the neck, both lateral and anterior. We've done really well, and we're almost there. Just a little left. Step 3. Check how you use your platysma. Identify the most common dysfunctional habits. Let's go through them. 1. If you often purse your lips or notice drooping corners of the mouth, this can lock in a negative facial expression and significantly overload the platysma. So try to pay more attention to this. 2. A tendency to slouch and keep the head down. Naturally, this impairs circulation and contributes to swelling in the submental area or under the jawline. But all of this, both swelling and fat, ultimately weakens the platysma. 3. Be careful not to overstrain the platysma during gym workouts. When you lift heavy weights or perform strength exercises, pay attention to your neck. It should remain relaxed. 4th, as I've already mentioned, frequently jutting the neck forward, for example when using a phone or working on a computer. All of this leads to overstretching of the platysma. And lastly, the 5th and very important point, the platysma can tense during strong emotions, shouting, and highly expressive speech. Although in everyday life, the platysma should not be involved in articulation, so allow yourself emotions. There's nothing wrong with that, but at the same time, don't forget to relax the neck muscles. In other words, the platysma should not be engaged in this process. Don't speak with your neck, don't shout with your neck, use your lips and your articulatory muscles. Well, everyone, I really hope you've understood everything clearly. I hope the techniques worked well for you and that you felt the results. The most important thing is, don't rush and don't expect a quick wow effect. Work on the platysma takes time, sometimes several months, but the results are, I have to say, always stable. And if everything is done correctly, the outcome is guaranteed. I'd really appreciate it if you could support this episode with a like. I put a lot of work into this channel and truly hope you find it useful. I'd be very grateful if you subscribed and stayed with me here. It really helps me continue sharing this content. See you soon.